because we just came in, saw the program. Then we listened for a while. Then we ask, okay, since that we can communicate with you people.
Okay, thank you, Tony. I think we can accommodate you. We'll do that really quickly. He says causes. Okay. Causes of hepatitis.
We talked about the viral causes, A, B, C, D, E. And then we've talked about chemicals, some of the insecticides or pesticides we use on the farm, alcohol. Then we talked about excess fat accumulation, especially in people that have diabetes. So drugs, some of the drugs that are prescribed, these are things that can cause hepatitis.
So if somebody is obese, that's enough reason to have hepatitis?
It's a risk, yes.
It's a risk factor
of having some form of hepatitis, yes.
How high would you say that risk is?
Oh, high enough. And many of these people, we ask them to go for ultrasound scans and blood tests, and then we find out that their cholesterol levels are high. Ultrasound shows the patient has fatty liver, and usually these people have, you know, some form of ill health. They're not feeling too well. You do test and you find out that what we call the liver enzymes are very high. So yes, excessive fat accumulation in the liver can cause hepatitis.
Okay, let's go back to the vaccine. Who, again, would you say is eligible for a vaccine in adulthood? Remember you told me some people actually catch it in adulthood?
Yes.
But they're not supposed to.
No, why wouldn't they? If they've never been exposed to the virus.
Yes, I do remember that. Yeah. We started having hepatitis vaccines in Nigeria just a short while back. Yes. So people like you and, and me are probably in need of a dose, right?
Yes, especially if we've tested and we're negative, yes.
Okay, let's take another call from Abu, calling from Abuja. Hello.
Hello, good afternoon.
Good afternoon. Please, let's go on with your question.
I am diagnosed with hepatitis B about 2007.
2007.
And I did the viral load. And I was told that mine is the type that is dormant.
Dormant, okay.
That is dormant. That if I didn't do the test, I would have lived with it. Is it possible that one will live with a hepatitis B that is dormant, that you cannot be treated?
Okay. Do you understand this?
I think so. I think so. Yes, we have, when we do get the long-standing hepatitis, now called chronic, okay, there are different stages. There are some where the virus is replicating in its thousands, in millions, and there are some when the virus is just dormant and quiet. Sometimes you can't detect, you can't count how many, you know, there are in the blood. So for those kind of patients, especially when the liver is not showing sign of damage, we usually will not treat.
So he has it, but it's dormant?
It's dormant, yes. So it's not everybody that has the infection that will go on to have liver cancer or liver failure. It's just like 20 to 25% that will go on.
And it's by this viral load that you determine who may go on to have...
The viral load, the liver enzymes, okay, the age of the patient sometimes. Those are the things we look at. So it's not just one thing or one test.
Okay, that was really... Now, the virus itself, how long can it live outside the body?
Oh, it depends on the situation.
So if you leave a clipper sitting for maybe a day,
it will survive.
It will
survive for up to a week, at least a week. In more temperate climates, it can survive for up to 3 months.
Okay.
And if it's kept in something and it's kept in the freezer at -20, it could be there for years.
Years? Yes. How many years?
Oh, many years.
So it's really important that people know their status, so to speak.
Yes.
You know, a lot of things are not given the right emphasis, it seems.
Exactly.
There's just one liver. What happens if somebody cannot use his liver anymore?
Well, you have to look for a transplant. We have liver transplants, so he'll have to try and get a liver transplant.
Okay, a liver transplant. Well, we are about to close, really. I'm just trying not to close without bringing closure to this thing. Let me ask you, finally, when someone is treated for hepatitis, is it free forever? Does it take it out of the body? Or is it something you have to live with?
Okay, well, let me use an analogy that most of us are familiar with. When somebody has diabetes or hypertension, okay,
Let's do
the
that quickly.
treatment, yes, the treatment is usually for life. So we control it, we manage it. It's the same thing with hepatitis B. And hepatitis B is a chronic condition, and it's managed either with medication or the patient is able to keep the virus at bay.
But can the person live a long,
Yes.
normal, fulfilled life
Yes.
like every other normal person?
Yes, indeed.
Thank you so much for coming, Dr. Woshini. It's been wonderful. Thank you. It's been great having you with us. Thank you, Tony. Thank you, Abu, for sharing your personal information with us. I'm sure a lot of people have learned from that. Have a great day. I am Mary Alale Yusuf.